Hello, and thank you for participating in today's Caregiver Tel Connections session entitled I Made a Promise, How to Cope with the Guilt and the Heartbreak. My name is Minerva Villarreal. I am the Foundation Program Coordinator with the Caregiver Tel Connection. I have been with this program for over 13 years, and today's presenter, we have Jamie Tinsley. She's a certified Alzheimer's educator and Montessori dementia care professional, is the Vice President of Dementia and Caregiver Education at James L. West Center for Dementia Care. She has been working in dementia care for over 15 years. Jamie has developed and implemented a variety of innovative programs that focus on enhancing the quality of life for individuals and families living with dementia, and leads collaborative models of training for current and future healthcare workers. And with that, take it away, Jamie.
Thank you, Minerva. We appreciate the invitation to be here. We appreciate you all to be on, as we are going to talk about how to cope with heartbreak and when we have to make hard choices as a care partner. Whether we're the family care partner or a professional, there are hard choices that have to be made. And how do we cope with that and manage the feelings and emotions that come along with it? So I am with the James L. West Center for Dementia Care. We are a not-for-profit organization, and we serve persons impacted by dementia. So we do have a community here in Fort Worth where we can serve persons diagnosed with dementia for a long-term care. In our long-term care community. We can do short-term rehab with them. We have adult day services also, but then we provide our free education for anybody that needs just education on how do we care for persons with dementia, whether it's professionally or it's personally. We are here to do that. We take pride and we are very committed to not only caring for those that have the disease, but those that surround their care. So really the family members and those professionals that are supporting the care of them, because caring for those individuals is just as important as caring for the person with the diagnosis. So I appreciate you being here and knowing that it's important to take care of ourselves as their care partners. We are going to cover quite a bit of information over the next 45-ish minutes, but really we're going to talk about the promises that we made, when we made them, how we meant for them to be made. We're going to talk about how to cope with those feelings of guilt, which is a huge feeling that comes along being a care partner. And what does that really mean? We're going to compare guilt versus remorse and maybe regret. And then we're going to spend some time on recognizing how do we mend? How do we cope with these feelings? How do we mend a broken heart? Whether it's after we move somebody into a different community or it's we just had to make hard choices along the way. Maybe it's we had to give up or have them give up the keys for driving, or we had to change their medications, or we changed how the treatment plan went, how we brought people into the home to help. All of these things that are hard as being a care partner. And then we'll talk about self-forgiveness. So how do we work through these aspects of being a caregiver? But I want to start off, I'm going to read this ad for you. So it's the perfect caregiver wanted. So wanted, a full-time caregiver for a dementia patient. Must have unlimited stamina, be energetic, alert and attentive, friendly and caring, totally understanding and forever patient. Must be willing to always subordinate your own needs to those of the patient and have few of any other commitments. Must know how to handle any situation. A background degree in psychology or human relations preferred, plus basic nursing skills, basic knowledge of medications and how they're in their interactions, as well as their side effects. Must be prepared to work for no pay and expect little, if any, appreciation for the above abilities from the patient. So I don't know if you identify with that want ad there, but sometimes that can be very true of those that we love and that we provide care for. But these really kind of are the rules, we have these rules for being a caregiver. We are asked whether these rules are put on by ourselves. We put those rules on ourselves, or other people might put them on us. But sometimes we have to be loyal, right? We have to be perfect at everything we do. We have to do it all ourselves. Don't rock the boat. whether it's with the person you're providing care for or other people that are involved. We got to meet everybody's approval. We don't want to be selfish, of course. We have to do it all. We have to do it perfectly, and we had to do it right, and we have to do it now, or it should have been done yesterday. Right? So all of these quote unquote rules are imposed on caregivers, whether it's self-imposed or imposed by others, but those are unrealistic, right? That's just not the way that we live life. And if we were looking at somebody that we love dearly, we wouldn't impose those rules on somebody we love dearly. But sometimes we impose those on ourselves or feel like we have to do that. So we're going to work through all this stuff. Let's start with some caregiver statistics. So knowing that caregivers are referred to as the hidden patient. I know our medical director and other medical doctors we've worked with have said, when I have a patient that has dementia, I don't have just one patient. I have at least two, because their care partner, that family member, or whomever's providing that primary care, is also got to be my patient, because they're the ones going to be doing most of the things, and they're going to need that help and that therapy. So there's, but they're not always referred to that. They're a hidden patient, right? In 2023, there's 16 million Americans that are providing unpaid care for people with dementia. And these caregivers provide, so this unpaid care really adds up to close to $19 billion of care valued at nearly, excuse me, 19 billion hours of care valued at nearly $345 billion. So if we were to pay those unpaid caregivers, mostly family members, that's the cost that it would in hours and in money. 24% of the population, adult population in the US, are caregivers. There's a lot of people out there providing care. And I would even say that number is under, or it's not, the number is higher, because I don't think a lot of people would identify themselves as caregivers. I know a lot of spouses don't say, well, I'm not a caregiver, I'm a spouse, and that's just what I'm due. So they might not use the word caregiver. And other cultures as well don't necessarily use the word caregiver too. So I think that number is a little bit low. 75% of those are women. About 3/4 of it are daughters providing the care. 59% work outside of the home. So they are working either full-time or part-time and then go home to being a caregiver. And then 1/4 of all caregivers are a sandwich generation. So they're not only providing care for an older adult, older parent, potentially a grandparent, but also at least one child that's in the home. And 34% of caregivers are the age 65 and older. It's important for us to know this, excuse me, to get this demographic background of caregivers, because we want to understand that there is a lot of joy, there's a lot of reward becoming caregiving for somebody. There's so many great things, and for most of us, we wouldn't do anything differently providing care for our loved ones. But there also can be a cost to caregiving if we do not take care of ourselves. So on here, there is an increased risk of early death for caregivers if they are not managing their stress levels and managing their own health, physical and mental and emotional well-being. So caregiving spouses between the ages of 66 and 96 who are experiencing mental and emotional strain have 68% higher risk of an early death or dying than the people the same age who are not caregivers. So people that are caregivers in the age range of 66 to 96 that are experiencing high strain mentally and emotionally are at 68% higher risk of dying earlier than those people in their same age range that are not caregiving. And then for adult children, they are 64% higher risk of dying over the course of their caregiving journey if they are caregiving for more than 4 years. And again, the stipulation is that they're experiencing high mental and emotional strain. Okay, so they're not taking care of their needs. So those are high statistics. They're kind of shocking statistics. So it's important that we either need to learn how to take care of ourselves or share this information with those we know are caregiving, so we can help maybe prevent this and lower some of those numbers. And we can get back to receiving more joy and gratitude and the rewards of caregiving, as opposed to some of the bad things, the bad things that can come along with caregiving. So this is from the Rosalin Carter Institute for Caregivers. And this is, really what is happening to caregivers. So if we do not begin to seriously address the needs of caregivers and provide necessary supports, this indispensable, largely invisible component of our healthcare system is in danger of collapse. So this really sums up, we saw the number of hours it takes. We have for unpaid caregivers, the numbers that go behind that, 345 billion. We just looked at the statistics of their increased risk for early death because of the emotional and physical strain. And really these family caregivers or these unpaid caregivers are the backbone of our healthcare system. But they're not really recognized. There aren't a lot of support services out there for caregivers. So I appreciate you being on the program today. Maybe you're listening to the recording and taking note of, well, this is kind of a tsunami of information, not information, but a tsunami of a healthcare crisis, healthcare system crisis that we need to address. We need to do something about this. And a lot of this is really managing that physical and emotional strain that can come along with caregiving. Like I mentioned, caregiving is rewarding and it's great, and most people would not do anything differently. But caregiving also does provide strain. There is stress that comes along with caregiving. There is more responsibilities that come along with caregiving. And it's with not just the care partner and the care receiver, but all of everybody else that's involved in that caregiving aspect or situation as well. So there's a lot of complex components that go into caregiving. And we as the caregivers have to learn how to take care of ourselves. We have to learn how to recognize added stress, added strain physically, but also emotionally. And what we're going to talk about today is one of those emotions that is one of the most overriding, overwhelming emotions that come along with caregiving. And that is guilt. That is the guilt of being a caregiver, of the choices and decisions that sometimes are presented to us that we feel like we may not have a choice. We may not know what to do. We made a choice in the past and now we might wish we would have made a different choice. It's this guilt that really can be paralyzing if we don't know how to take care of ourselves or don't know how to work through it. So that's what we're really going to work through today. And I'm going to frame it in to start off with, because we're talking about hard choices. And one of the hardest choices a caregiver will ever have to make or broach is moving their loved one into a community or bringing help into the home. Particularly caregiving for somebody with dementia, there will come a point where you absolutely have to have help. Because physically it can be overwhelming, it can be too hard, but then there is the time, there's the emotional side of it, there's the mental, the mental side of it, the financial side of it, the social side of it. It is impossible for one person to provide 24-hour care to another person that is living with an illness like dementia. Impossible. So we will have to get help. And one of the hardest choices I mentioned is, when do I get help? When I bring them into that home, or when do I possibly move my loved one into a community of sorts? We really can't answer that question, right? There's not here's what happens at this stage and on this day, and when your loved one does X, Y, or Z, that's when you do this. There's not a black or white answer. I wish there was. I think it would make things easier, but there's not, and each person is so different, right? But it does come down to safety. So that is, because we get asked all the time, well, when do I know it's time to get that help or to move my loved one? And it comes down to the answer of safety. And when we say safety, it's physical safety and emotional safety. And this is safety for that patient or for the person with the diagnosis, physical and emotional safety. If I physically cannot care for my parent or my spouse, because they fall and I can't pick them up off the floor, or I physically cannot help them in the shower, then that's a safety concern, right? Not just for them, because I can help them, but I could also hurt myself. So that's safety concern. for the patient and the caregiver, but then there's also the emotional safety of it. If I've given everything that I have, not just physically, but I've given all of my energy, I've given all my patience, I've given all my kindness, I've given everything that I have, and I just don't have anything else left to give, that can be I'm emotionally not able to provide that care because I don't have the patience or the energy or the kindness or the creativity, right, to problem solve for my loved one. And then sometimes there can be other emotional issues that come along with this, higher anxiety, and my anxiety levels are too high that I'm just not able to provide good care for my loved one, much less myself. So there's the safety issue of the emotional safety. And the feeling emotionally safe means accepting that you can't control everything and trusting in your ability to cope. So we can't control everything. We can't control other people. We certainly cannot control the disease and the progression of its illness. The progression of this illness. But can we trust in our ability to cope? And if we cannot trust in our ability to cope, that would be an emotional safety concern. So that is, a good way to answer, when do I move my loved one or bring into the home? And it really is a question and answer of safety, physically and emotionally, for both the care receiver and the caregiver. So when we make promises, whether it's, a typical promise is, I'm not going to move my loved one into a nursing community. I've made that promise. They've asked me not to. We're not going to do that. When we make that promise, we base it on the information that we had at the time. At the time we make those promises, our loved one is generally not in the same place that they are now as they've progressed through the disease. They may have been more active, they were more healthy, they had more of a sound mind, they had more abilities to take care of themselves. And we really had no way of knowing how this disease was going to progress in our loved one, and what it was actually going to take care of them. Because with dementia in particular, there is some physical decline later in the disease state, but it's the cognitive changes that are happening that we really cannot predict. We can fairly predict the way the disease will progress and how it moves throughout the brain, the different functions of the brain that'll be affected, but how it affects each individual, we really have no way to predict that. Or we have no way to predict the toll that it's going to take on us either. So we have the best of intentions, right? And we meant it when we said it. We meant it when we said that promise. And our promise is one of good faith, okay? We may have thought that we could keep them at home. We just bring in a little bit of extra help. We might use an adult day service program and still keep them at home. We can still use the respite and still keep them at home. And that might work perfectly for a period of time. But we also might not have known how expensive it was. The hourly care that comes in, or how it costs to go to an adult day program. All of these things that we, especially if we've never done it before, we may not know the answers or really can predict all of those, like I said, multiple components that come into caregiving. We could have been in denial when we made those promises and said that it's never going to get that bad. And it may not ever get that bad. Whatever that means, it's different for each person. But again, we can't always predict that. And all the decisions and promises that we make are out of love. They're out of love and caring for our loved ones. And let's think back. Let's think back for when you were younger, or you don't even have to be younger. When I say the word nursing home or long-term care community, what image comes to your mind? Are they images from decades ago, or maybe from a nursing home where you saw your grandparents in? In a long time ago, nursing homes were not, a desirable place to be. Quite frankly, a nursing home is not a desirable place to be today, but things have changed dramatically in those. But a lot of us are basing information on past perceived, but also past true experiences of nursing homes or long-term care communities. But they are not, nursing homes are not today, are not what they were of the past. And that's what we promised. We didn't want to put them in a place that what we thought of in the past, or maybe an experience we've had in the past. And here are some pictures, if we compare, maybe this is what you thought of when you thought of a nursing home or a long-term care community. People just lined up against the wall, no interaction. They're just sitting humped over in their chairs. Or it's very institutional. It looks like a hospital, and that's really no place to live, right? It's all hospital-like. There's a lot of equipment, medical equipment out there. People are just kind of roaming around without any purpose or without any structured activities. But today that's different. The nursing homes, long-term care communities, assisted livings of today are different. Yes, there's still a medical component because they're there to, first and foremost, to take care of their residents and their people. But life enhancement and life engagement, enriching activities are first and foremost of the care that's provided. So they're bringing in whole person wellness. So it is, yes, physically, we want to make sure they're safe and taken care of, they're getting the right medications, etc. But there's the social aspect that now is a huge part of the care. There's the emotional, there's the mental aspect, there's the spiritual aspect that really is first and foremost of the care that is now being provided in long-term care communities. So you can see the socialization, there's purpose, there's engagement. They're around people that are just like them, and the activities and the environment and the care is set up to match the abilities of the residents that live there. So sometimes we have to step back and think, well, what am I envisioning when I think of moving somebody into a new into a home somewhere, or bringing home into the house, or care into my home? Sometimes we have to really research and say, well, what's really out there? What does it look like today? We might not have also realized through the strain that it puts on our other relationships, or maybe the job that we have, or work, or raising our families, because caregiving is a lot of time. It can be a lot of time. It's a lot more added responsibility, and it can be a full-time job. So who's still working full-time and then, like I said, go home to do a full-time caregiving job? I apologize. But when we make these promises to our loved ones, we really base it on the facts and the beliefs that we had at the time. And that was the best decision or promise that we could have made at that time. But times have changed, situations have changed, not only for you, but for your loved one as well. And things always change with a terminal progressive illness. No matter how much we hate, or we might fight making those hard decisions, life does go on, life gets in the way, and we're going to have to come in and make those hard decisions. I hear it, I heard it earlier today, hear it all the time. I'm going to keep my loved one at home for as long as I possibly can. And I think that is a great, I would say the same thing. I did say the same thing for my mom. We're going to keep her at home for as long as we possibly can. Or I'm just going to keep her at home no matter what. Whoever said that, well, we don't know what the future holds, okay? When life happens, and particularly with dementia or another progressive illness, so it's terminal, what's going to happen physically, mentally, emotionally, not just to that person, but to us as their care partner, their care provider, and all the relationships around it. Because it does, dementia and other progressive terminal illnesses are really insidious, and it impacts just about everything around us. And we need to make sure and protect some of our relationships and set barriers and protect ourselves. But when we do make these decisions, there's the guilt. All right. We may not have understood how the disease was going to progress. We made these choices or these promises, and then we might have to break that promise that we made. We might have to, because we didn't know, and now it's become not feasible or not possible for mom to stay at home anymore. It's not the best place for her because it's not safe for a variety of reasons, and it's not safe for us as that care provider too. So we place them, we move them, we bring bring care into the home, whatever it looks like, and then we have the guilt of that. And guilt is often tied to feelings of, well, I should be able to take care of my loved one to the very, very end. We have that guilt that we've self-imposed, right? Sometimes for some of us, our loved ones might make us feel guilty too. It might be the person that we're providing care for, but it also might be loved ones that are around us that might make us feel guilty too. But know that we all have limits. We cannot do everything. Like I said earlier, it's absolutely impossible for one person to take care of another person 24/7 because there's two people involved in that, not just one person. We may feel judged by others for a placement or a move or adding in extra help. Sometimes what can happen is we might move our loved one into a community and then they seem to get a little bit better. We see it at the West Center frequently. Somebody comes in and moves in and they get better. Not saying that they regress or reverse the disease of dementia, but they get better because what happens is when we move somebody into a care situation, whether it's long-term care or provide home and bring care into the home, we are providing care that matches what their needs are. So for instance, somebody comes to the West Center, they move here, and now they are getting taken care of. All their basic needs are provided, right? They're getting nutritious meals. They are getting their medications administered correctly. There's nursing oversight. So we're seeing all of the aspects of that. But then there's programming, activities, life enrichment that is geared towards that person, matching what their disease, where they are in the disease state, matching what their abilities are, their likes, their dislikes. They get to be around people that are just like them. You know, they're not just sitting in front of a TV all day. They get to have that socialization. They get to be a part of the community. And now, and when we fold them into the community as they're here, there's a purpose, they're worthwhile, we need them here. Not that we don't provide that at home, but like I said, it's hard for one person to provide all of that. When here, you know, in a nursing community or assisted living, you have full-time staff providing all of that aspects of care, when generally at home, it might be one or two persons providing all this variety of care, whereas at a community, you've got 20 people providing that type of care. So it's easier for 20 people that are experts in the care of nutrition or life enrichment activities, medication management, you name it, providing all of that care as opposed to one person doing it all. It's not possible. So a person might move in, they seem to improve because they're getting the care from all aspects that matches what they need. Excuse me. So we might have a guilt for that we weren't providing that care for them, but it's not possible for you to provide the care of a fully staffed nursing or assisted living community. And then sometimes we might have feelings of relief after we move somebody or we get that extra help in there, because there can be a relief that comes along with it, because now you start to get your life back. You get to have time to yourself. Now you get to really sit down and focus on, like, oh gosh, I haven't slept 8 hours straight through in a night and for as long as I can remember. And we might just start to feel, and then, you know, the feelings of relief and gratefulness of that, then we feel guilty for feeling that. But guilt is very normal, okay? But we have to be careful about how we manage that feeling of guilt. Because generally what we say and how we manage guilt is, well, I should have, I could have, I need to. When those statements should have, could have, need to are statements that are based in unreal truths. Like, I should have kept mom home till the end. Well, that's not true, because that wasn't the best situation for her or you. I could have kept her longer. You might not have been able to keep her longer without serious consequences. So we're saying these statements that are based in untruths, and they're based in guilt, that really guilt, and so the definition of guilt is having committed something, some specific offense. So I've committed something, or I've done something wrong that I know was wrong. And there's guilt that follows that. And there should be. Guilt is a healthy emotion. right? We need to have guilt for when we do something wrong or we've committed a specific offense to somebody or something. But generally, when we're caregiving, we're not committing a specific offense or we're not doing something intentionally harmful to our loved ones, right? So a better way to, or another word to not use, because guilt is based in untruths a lot of the time in caregiving, because we're not doing something intentionally harmful. A better word to use is remorse. So can we take out the word guilt and replace it with remorse? Because remorse means it's a deep regret for something that went wrong. It's remorse versus guilt. I'm remorseful that this has happened. I regret that this disease progressed. I didn't want to move mom into a community. I'm remorseful of that. I regret that, but I don't feel guilty about it because I didn't do anything intentionally harmful or wrong. So what we may be feeling is remorse over something that we wish we could have done, wish we could have kept them at home, right? Or didn't need to bring in that extra help. So we need to call it what it truly is. Chances are you did the best you could with the facts that you had at the time and the knowledge that was available to you. And most of the time, hindsight's 20/20, right? So we got to be realistic with ourselves. And this a lot, it comes down to what are we telling ourselves and what are the truths we're really believing about this. So we're actually feeling more remorse rather than we are feeling guilt. So we have to be honest with ourselves about this. And I'll take a quick side note on to grief. So grief is an emotional and physical reaction or response to a loss. And it can come from any type of change that we've had or any type of perceived loss that we have. So we, as a dementia caregiver, we will incur many losses as we go through this journey. And a lot of the losses might be losses as our loved ones decline. So we are losing a little bit more and more of our loved ones as they decline into the disease process. But then there's also the losses of, I wasn't able to keep mom at home for as long. We weren't able to travel after we both retired like we thought we were. You know, we did have to sell our home to help pay for the cost of caregiving. So there's all these other losses that are happening too. And grief is normal and it's expected. If you weren't grieving, then that would be abnormal. Okay. And but sometimes this grief can be overwhelming. And one of the biggest challenges after a move or making a really hard decision is learning to live separated from your loved one, yet still having them very much part of your life. So there's this whole new adjustment period, right? So there's this loss of my loved one's still here, but they're not here in my home, in their home. And there's that adjustment period, and there's the grief that can come along with that as well. So there's a lot of complex emotions happening, but we have to be honest with ourselves. So how do we cope with this? Okay. How do we cope with the guilt and the grief that can come along with this? We have to be gentle with ourselves. We are gentle with our loved ones, so we have to be gentle with ourselves, and we can't change the level of care that they require. If it's come to a point where we've had to have extra help, we needed to move to a community, or we needed to move into hospice, or we needed to move to a higher level of care, we cannot change the level of care that our loved one needs. We can do the best we can, and we have been doing the best we can, and it has always been enough. The care we have provided has always been enough, and this might be an affirmation that you tell yourself frequently. And a great way to do this is talk to yourself as you would talk to a close friend. So if you had your best friend sitting in front of you and they were taking care of their loved one with dementia, and let's say they just moved them into a community and they were feeling a lot of guilt, what would you tell that close friend? Or what would you tell a spouse or whatever? What would you tell them? Would you say, you know what, you should feel really guilty because you caused harm and I can't believe you moved them into that community and it's just going to be downhill from there? Probably not. It's probably not what you're going to say because that's not true. And that's hateful, right? So we wouldn't say that to our friend. So what would you say to your friend if if you're talking to them? Would it be, you know what, you've made the best decision that you can make for not only your loved one, but for yourself. I know this is extremely hard and it's confusing and it can be scary, but you're doing the best thing for both of you. You might say something more along those lines. So if you're going to say that to your friend, that's what you need to start telling yourself. Okay, so speak to yourself like you would a close friend. And if you have other thoughts that come up, like you did something wrong, you should feel guilty, this is the worst thing you could have done, you have to stop that voice, because that voice is a false voice. They're throwing lies and falsehoods at you. And sometimes our brain does that to us, but we have to stop it. And we have the power to stop that voice. And those are really twisted or distorted thoughts, and we can unchange those thoughts. And those thoughts need to be more based in truth and reality. So I have on here, if you are a biblical person, 2 Timothy chapter 1, verse 7, we are not ruled by fear. And I know there are many other religions or spiritual guides out here that also know, or also their teachings are based in, we do not live in fear. We were not ruled by fear. We were not created to live in fear. So we remind ourselves that that you honored the spirit in which you made the promise, even though you had to break it. The promise that you made was that you were going to provide the absolute best care that you could for your loved one. That's the promise you made. It may have sounded like, I'm not going to move you into a nursing home, but what you were really making, the spirit behind it was, I will provide you the absolute best care that I can. And again, we didn't know. We had no idea what was going to lie ahead. We didn't know how the disease was going to change. All of these things. So we made the promise of providing the best care for that person. Period. And we wouldn't allow their well-being to be unsafe or unsustainable for either of you. And really, if you were able to sit down and to talk to your loved one right now, and they were lucid and they were maybe in their past, what would they tell you? If I were able to sit down in front of my mom and ask her, what should I do right now? I don't know the decision to make. What would they tell you? What is it, your parent, is it your spouse, a sibling, a grandparent, a best friend? What would they tell you to do? I know my mom would say, go ahead, we need to both get the best care that we can both get. And right now, that might be at a higher level of care, or that might be putting me on hospice. So can you visualize in your mind's eye, asking them, and what would they tell you? So another thing is, we need to trust ourselves. You did the research that you needed to make, the research that you needed to do, and you did not make a rush decision. It was an informed decision. You educated yourself, and you made the best decision for you and your loved one. And we don't second guess ourselves, and we don't allow other people to make us second guess ourselves either. We trust ourselves in the work that we did, and we give ourselves permission to feel the hard feelings. All right, permission to feel the sadness, permission to feel the anger, permission to feel the guilt and the remorse and the heartbreak. We got to let these emotions out. What you're feeling is a very normal reaction, but we need to name those emotions. We need to own them. And then we need to say, sometimes we might need to reframe them. Again, is it remorse versus guilt? Okay. Not feel guilty about it. I'm just remorseful. I'm not angry with my loved one. I'm angry with the disease. I found myself saying that a lot. Okay, it's not my loved one. It's not my mom. It's the disease. And that's what I don't like. Okay. But then we vow to take one day at a time from there. Okay. Permission to feel those emotions. And then we stop ourselves from the negative self-talk, the self-talk that's untrue, and the self-talk that tears us down. We can add extra stress, extra worry, extra anxiety, extra guilt to ourselves when we're using or when we're saying negative stuff and saying things that are not true. So it's kind of like we get shot by an arrow. I think this is a Buddhist teaching, but we get shot by an arrow, and then we continue to make it worse by shooting our own selves with the arrow. So we get diagnosed with a disease, or our loved ones, we're the caregiver, so we've got one wound there, but then we continue to shoot our own selves with this negative self-talk and feelings of guilt, and because we keep beating ourselves up. But again, talk to yourself like you would your dear friend and accept nothing else. And then we shield ourselves. So we limit exposure to those who might make us feel insecure, or those who might make us self-doubt, or question the decisions we made. If they make you feel anything less than confident in what you are doing, and confident in skills and the decisions that you've made, then you might need to shield yourself or separate from them, or have an honest conversation with them respectfully, right? But you are the caregiver, and you know what's best for both you and your loved one. So give yourself time to focus on yourself. Like I mentioned earlier, are you doing the entire work of a nursing community? Are you the nurse and the dietitian and the administrator and the CNA and the housekeeper and the life enrichment activities person? Are you all of those? Have you been doing that work, the work of all of those people, for a long, long time now? When we invite help and accept help, we provide the opportunity for persons that are experienced and licensed, nurses, CNAs, dietitians, to provide that care. And we can step back and we can come in with this quality of life care. This is not a marathon. This is not a sprint. It is a marathon. So we have to invest in ourselves. We have to pace it out, really, right? And that last bullet point there on the screen, we need to refocus and become our loved one's wife, husband, daughter, son, friend, sister, brother, etc. Again, when we allow the people that are trained to do the nursing care and the dietitian care and all of that stuff, we allow them to do that. We find trusted people and we keep an eye on it, right? But it allows me the time to refocus and come back as that daughter, or as that spouse, or as that sibling, and provide that kind of care that nobody else can provide, quite frankly. So support yourself. We reach out for help. There's a lot of support groups. Continue to come on to education. I know the Tel Connect has so many great programs that you can listen to live, all the recordings that come out, and they're really good about sending you emails with the reminders. Talk to a counselor. Maybe it's a spiritual leader or a minister. Maybe it's somebody that's been through this before. It's just talking to people that can support you. And then I encourage you to do one pleasant thing for yourself every day. And that might be enjoying a cup of coffee. It might be reading a chapter of your favorite book. It might be going for a walk. It might be meditating. It might be taking a short nap. Whatever it is, but do one pleasant thing for yourself every day. And that can help us refocus. That can help us manage our stress levels. But it can also help us sit back and be realistic about what expectations are. And then lastly, we need to forgive ourselves, okay? It is okay. You can do this. You deserve it. You are worth it. Might need to let it go. You are not a bad person. You did not fail. No one is perfect. And we do not dwell on the past. And we focus on the present, and we are mindful. And then we challenge ourselves to help others with the knowledge that we have gained. And I will leave you with the Serenity Prayer because it is so appropriate. But grant me the serenity to accept the things I cannot change, the courage to change the things that I can, and the wisdom to know the difference. There are some resources here, and I will stop sharing if there are any questions or anything anybody wants to share.
That was a great presentation, and showing the saying at the end, that was exactly the same thing that popped into my head.
Right.
A question that popped for me is, how do you handle the guilt from like customs, the regions that you live in, the ethnicities? For Latinas, it's supposed to be the daughters who take care of it and things like that. What would be your recommendation handling that type of guilt?
What a wonderful question, Minerva. Yes, because there are the cultural differences that come up, right?
Yes.
And I don't know the answer, honestly, but you know, kind of the same things that were in the presentation. We have to, you know, protect ourselves, shield ourselves. But I think a lot of it would be research to know, really research to know the disease you're caring for. And dementia is a hard disease in in all cultures. But because it is confused as, well, it's just a normal part of aging, when it's not a normal part of aging. This is a very abnormal part of aging, and there are so many resources out there for care. And I think it all comes back to, and I believe this to be true in all cultures, I want to provide the best care for my loved one. Now, I'm not saying everybody rushes into a nursing home. I know nobody wants to be in a nursing community by any means, but what is that care in education? Education, I think, can treat a lot of things, but also the care from family members, community-based organizations, support, all that stuff that we can start taking advantage of as a family to provide this best care. So I would say a lot of it is education. And how do you come at it with education, you know, in different cultures that don't necessarily want to talk about it? And it might be from a different approach of, well, hey, we're just going to be healthier as a family overall, you know, and the wording is important. The family, we're doing this as a family, and we're going to be healthy. We're going to change some things here. I think that's a place to start, at least. And then so, you know, family wise, but then there would be a lot of individual. How do I accept this? How do I set boundaries? How can I do these family dynamics? Can I assign certain responsibilities to other family members, right? Without them knowing, I'm assigning them certain things. You know, and and I think sometimes a lot of it is really just being honest and asking for help and saying, yes, I am here to care for, you know, mom and dad and everybody, but I need help in X, Y, and Z. Most people want to help, family members, non-family members, they just don't know how. And they wait for other people to tell you how to help, right? And if we don't ever ask them for help, then they think everything's fine, they don't need help, and then there's misunderstanding and miscommunication. So I think it is, I'm here to do this, but I need help in these areas. Can you do X, Y, or Z? I hope that answers your question and kind of at least gets it started, right?
It definitely gets it started. Trudy put on chat, thank you, Jamie. You have lifted a burden out of my heart. I am grateful for your wisdom. I needed to hear every part of this. And I think that's a sentiment that we can all share. Does anyone want to ask Jamie a question? Go ahead. Sorry, go ahead and unmute yourself. If you dialed in, you can do *6 and that'll unmute yourself. And I'll be able to see if you're muted or unmuted. Oh my goodness, it's allergies in this season.
Something in the air, yeah.
That's for sure. So I don't see anyone writing anything right now. Another guilt that I know, one thing I have noticed through my caregiving journey for my mom, and at the same time through working here with the Wilma Charitable Foundation, is, and especially dealing with someone with dementia, is I don't want this to happen to me, for my family, for my kids, for the future. And it's something I've already voiced to my sons. I've said, I don't want you guys being there and waiting for the last minute to put me in a home. If things get hard, go ahead and start putting me in. Because I know it was, like you mentioned, no one talked about what to do as things got tougher back in the days. And to this day, it's even hard to get my parents to say, this is what I want moving forward if XYZ happens. For sure. And on that note, I still don't see any more comments in the chat box. And with that, that is okay. Let me go ahead and give you all some information on the future Tel Connections that are coming up. We have a series this month, and it's on how to include caregivers in the care team, and it's a series for healthcare workers. We'll be offering certificates of attendance for this. And the first session is going to be on October the 16th. It's going to be on a Wednesday. It's going to be Elliot Montgomery Sklar and Lucy Barilak doing the presentations. And the first one's going to be defining caregivers and recognizing their experiences. I know it's one of the, we've had this presentation almost every year, and it's a great way to remind the professionals what the caregivers go through, as well as reminding the caregivers what to say to the professionals when the situation comes, what to do, and different things like that. After that one, we have on Monday, October 21st, Medicare and Help with Medicare Costs with Chelsea Lang. That one is sponsored by North Central Texas Caregiver Child Connection, and that is with our good friend Xanda Hilger, who will be doing that one. Does anyone have any questions, comments, stories that you would like to share? Your thoughts on this presentation? Please go ahead and unmute yourself. Raise your hand if you feel comfortable doing that, or just go ahead and put it in the chat box. Area code 480, go ahead.
Hi, I just wanted to thank you all. I came in a couple minutes late, but this was wonderful. I needed to hear this. We are very, very close, within a couple of months of placement, and I'm not to cry, but I'm sure I feel like everybody else. I needed this, and I'm very grateful. Thank you for putting it on.
Thank you so much for participating. Jamie, do you want to say anything?
It's not easy, either way, but I, stand firm in your research and your decisions, and know that you're providing the best care for your loved one, And I love what you said, Minerva, about as you're looking at this, well, now how do I, as I get older, right, how can I do this differently for my family? Do I need to express my wishes and wants earlier than maybe those before me did? So I appreciate you saying that. Thank you all so much.
And to mute yourself back again, just do *6 and that'll put you back on mute. I'm going to go ahead and start the poll for everyone. Like I said, this is how we know your thoughts, your opinions on this presentation. If there's anything you would like for us to do in the future, if you would like to have Jamie again in the future, go ahead and answer the poll. That it should have popped up right now. Another thing that we have coming up already in the month of November is our annual Caregiver Summit. Now, this year, like always, we have it broken down by two. One session will be in English, and one session will be in Spanish. And the English one is going to be on November the 14th. It's going to be from 10 a.m. to 12:30. And there are going to be some locations where we have SOS centers where you'll be able to participate in person. I'm going to go ahead and put the link for the registration in the chat, so that way you're able to register and take it from there. If you're having any issues with that, just give me a call at 866-390-6491. That is our main phone number, and I'll be happy to walk you through anything or answer any questions that you might have with the registration. I want to say thank you, Jamie, for this lovely presentation. I want to thank also the Wilmette Charitable Foundation for providing these programs for all of you. And I want to also say thank you to all of you for the job you're doing. I know it's not something that you get thanked for, but know that you are appreciated. And even if it's not said, you are loved for it. So thank you very much for that. And Jamie, go ahead.
I appreciate y'all. It is a journey for sure. It is a marathon. So know that and I know the WellMed Charitable Foundation, Tel Connect, but also the West Center is here to help support you. I know you can call Minerva, but you can also call us as well with any questions or concerns, or just want to talk something through. We offer support groups as well. So please know that there is help out there in your community, and you got to just take advantage of it. So we appreciate WellMed and Teleconnect for having this, offering these services. They are a wealth of knowledge. Thank you.
And there was one comment that came in, but by manager, my husband doesn't realize the extent of his limitations and often doesn't even want my help. He hardly ever showers or takes care of his teeth, refuses help from me or others, other visiting angels.
Yes, yeah, that is not uncommon to happen. So for a variety of reasons, there really can be a lack of recognizing their abilities, and that can be due to dementia. They do not recognize that they have a lack of abilities anymore. It can also be a little bit of denial. But also, let's think about this. Have they ever, the majority of our lives, we do not need help in the shower. I do not need somebody in the shower with me helping me. I do not need somebody helping me on the toilet. I certainly don't need somebody helping me brush my teeth. So this is not normal. And if I really think there's nothing wrong with me, then what the hell are you doing here? I'm going to resist, and I'm going to fight, and I'm going to refuse this care because I don't need the care. And with that, depending on how adept, like the visiting angels that come in, I think it's home health or home care, they might change their approach. And it might come down to how are we approaching them to help them with that care. And it might be that we have to manage our expectations that we can't get them to brush their teeth today. At least we got to get them we can get them to try and rinse out their mouth. And so we have to kind of manage our expectations. There are other things that we can do as far as not going into a full-fledged shower. You can do like bedside showers. They're called comfort care. You can buy them at Walgreens or CVS, but it's a full hygienic shower. You just get them in a package, and it's like disposable washcloths essentially that you warm up, you put it in the microwave, warm it up, and you give it to them, and they can wash their arms, their legs. It tells you exactly, this cloth is for their right foot, this cloth is for their back. And that way they're not getting into the shower, because the shower can be a whole thing as far as sensory, how they're perceiving the shower. A lot of it comes down to independence, it sounds like, but dignity as well. So are we coming in with this bossy, I'm going to come in here and do this for you? Or are we here to be friends and helpers? Or can we just hand them stuff and still allow them to do it, even though might be verbal cues, show them how to do it? It can be very complicated. And again, this is not uncommon for people to refuse care with their self-care activities. A lot of it is we just have to try different approaches. Sometimes it is our tone of voice, our body language. Are we being bossy? Are we taking over? Are we demanding? Or are we coming in and just really helping? Can you use a therapeutic story? I know with my grandfather, he wouldn't get into the shower. He wouldn't take a shower. He didn't need help shower. I already took a damn shower. I'm not taking another one. He hadn't taken a shower in days, but to him, he had taken a shower. So we would actually use the therapeutic story of, hey, grandpa or grandma was getting his husband, can you come here? The shower head's not working. Can you help me with the shower head? Something's off here. Get him in there to look at it and fix the shower head. He fixes it because we've turned on the water. Now all of a sudden he's got the water. He's got drenched in water. Oh my gosh, thank you so much. You fixed it. Now he's wet. He's in the shower. It was easier to get the clothes off of him. Go ahead and hand him the soap. It worked sometimes it didn't, but we had to try different approaches. We have a whole program on managing hygiene because it can be very complex, but
and there's another comment from Susan. My husband took limited showers. It was a dermatologist who spoke to him about it, and now he lets me wash him. It was also the water temperature that he did not know how to regulate it, and it's little things like that. And that's a great thing. half truth to do, you can always put the blame on the doctors. It's, well, the doctor said you should do this. They're not going to contradict you. That's always, and that way the blame can't be on you. You can say it's the doctor's fault. You can do this.
Right.
And thank you, everybody, for sharing your comments. It was great. I know we are at top of the hour, and I am very respectful of your times. I know we can take this for longer, but I'm not going to keep Jamie here forever. And with that, thank you, everybody. I hope to see you again in the future sessions that we have coming up. Again, if you have any questions, give me a call or send an email to me, and I'll be more than happy to answer anything. And if you have any questions for Jamie, again, go ahead and send them to me, and I'll be more than happy to forward them to her, and she'll be responding to those as well. Thank you again, Jamie. This was a great presentation. I know it was definitely something I was looking forward to, and very appropriate timing for me.
Thank you. Appreciate y'all.
Thank you, everybody. Bye-bye.
Thank you. Bye-bye.